think the Clinical Champions programme is really important for NHS staff, because I think as an NHS worker at the coalface, you're usually incredibly busy just doing the day-to-day firefighting of clinical care, and often it's very difficult to get that opportunity to stop and put your head above the parapet and actually take a wider look at things. And I think that's what the programme really allows people to do, to be able to take the time out, have projects that they can focus on through the programme, and also by being given that role as clinical champion as well, it gives them a bit more status to be able to actually stand up and do something important. And I think the day-to-day NHS work can become mundane, it can get people down, it can be demotivating, and I think this is the sort of thing that really can help motivate people in different ways and take them down new avenues and start to really improve care. Yeah.
So I think the programme empowers you and gives you skills that you would not necessarily develop otherwise. And I think the NHS is, characteristic of the NHS is change. Change is happening all the time in the NHS, but in the majority of cases, one feels that change is imposed upon one and that you don't really have a voice. And the Clinical Champions programme allows you to turn that round, and actually when changes come along, to have a voice and influence how that happens, and actually to implement one's own change and try and drive things in the direction that one thinks is appropriate.
As clinicians acting as change agents, we are working at the coalface, so we actually understand what some of the problems are. It's not saying that managers don't understand that problem, but I think there's a need to actually bring in the clinical experience actually into change, and I think that's why it's very important that we have clinical leaders. Yes, it is important to have management as well, but clinical leaders is very important.
The problem with the NHS is it has so many leaders, and often when you're working at kind of grassroots level, you feel that some of that leadership is not approachable, and maybe nobody would be interested in listening to what you have to say. But actually as a clinical champion you are a leader, and that's sometimes what we forget, that actually we are leading services, we are the voice for diabetes in our local area. So in a way we do have that leadership, and that the confidence that gives you to lead and take services forward is really important in long-term conditions, because more and more people will have diabetes in years to come, and we need to be able to inform the leaders that we have now, but also be the leaders within our own teams and take those projects forward.